Hello, Dr. Ava Bamdad. Thank you for joining us today. Just a little introduction from my end. Dr. Ava Bamdad is a recent USC graduate. I'm a current fellow in the MSL program at Neurocrine. Um, Dr. Ava Bamdad has experience in neurology, psychiatry, oncology, and even ophthalmology. So a broad range of experiences. So thank you for joining us today. If you want to go ahead and introduce yourself.
Thank you, Philman. So hi, everyone. My name is Ava Bamdad, and I graduated from USC School of Pharmacy in May of 2021. So just to provide some background of how I got to where I am today, initially going into pharmacy school, I actually didn't even know that the pharmaceutical industry was a career path for pharmacists to pursue. So I'm sure, as many of you know, most schools focus on either the community pharmacy setting or the inpatient clinical type pharmacy setting. So I actually pursued 2 inpatient pharmacy internships to set myself up for residency, since I thought that was the career path I wanted to pursue going into pharmacy school. And then later in my 3rd year of pharmacy school is actually when I realized that the pharmaceutical industry was another career path for pharmacists to take. And through that exploration, I kind of realized that I was mainly interested in medical affairs and specifically field medical or the medical science liaison role.
So taking it back to like pharmacy school, were you involved in any organizations on campus? And if so, do you feel like they helped you going into the professional world?
Yeah, so I was involved in SNAFA during my 2nd year of pharmacy school, and I did hold a leadership role within that organization. I was the director of immunization. And through that experience, I think that allowed me to further develop my leadership skills, which is a very important skill to have all throughout your career and also specifically within the pharmaceutical industry. And I was also involved in ROCHI, where I was able to tutor students through one-on-one tutoring as well as review sessions. And that allowed me to further enhance my public speaking skills, which I also think is a valuable skill to have within the pharmaceutical industry.
So how did you go about like getting internships and things like that during pharmacy school when you realized you wanted to go into industry?
Yeah, so initially in my 3rd year, when I realized that the pharmaceutical industry was a career path for pharmacists, I was speaking with one of my friend's colleagues who he connected me with, and just kind of telling him what my interests are and what I wanted to do in the future. And basically, he put it all together and said, well, I think you should look for roles within medical affairs. That seems like something that would interest you and suit you well. So I did apply to summer internships and was fortunate enough to land one at Amgen during my off blocks in my 4th year of pharmacy school. So basically like the summer of P3 year going into P4 year. So I took those 2 off blocks in the summer, which were blocks 2 and 3. And I was at that internship for 12 weeks, and it was on the medical affairs training team. And on that team, I was able to develop different training content and resources for the medical science liaisons. So I worked very closely with the MSL team and helped them with their onboarding as well as new training materials for existing MSLs. And through that experience, I learned more about what the MSL role actually entails and realized that that was a path I was super interested in. And then I also had 2 rotations within the industry. So I completed a clinical development rotation at AbbVie and also a rotation at the FDA, so more of the regulatory type setting. And through those 3 different experiences, I was able to confirm that I was mainly interested in medical affairs and specifically the MSL career path.
Nice. And like during these internships, how did you go about like networking?
Yeah, so when I was at my internship as well as the rotations I mentioned, I basically just reached out to people through email and asked if I can set up one-on-one informational interviews just so I can learn more about the different functional areas and what the different roles within the industry are. And then I also really utilized LinkedIn once I knew what I was interested in pursuing. I reached out to different MSLs as well as people just in medical affairs as a whole so I can kind of build that network. And my network also introduced me to their network. So I was able to just continue to meet different people, both at conferences during my fellowship, as well as just meeting people through my internship and rotations.
Nice. Yeah, most definitely. I know earlier when we were talking, you said that famous quote, your network is.
Oh yeah, so I mean, they always say your network is your net worth, and I think it's
Yeah,
so true because it's just this whole community of people that are there to support you. And once you meet certain people that are super willing to support you, they have their network that they'll introduce you to, and then you just keep building your network in that fashion. And I find it to be super helpful.
most definitely. I really like that quote when you mentioned it earlier. Um, so like, what about, if you don't mind talking about like LinkedIn? Like, how do you, we know like LinkedIn is such a big tool. And how do you go about like introducing yourself, making people familiar with your face, talking points, things like that?
Yeah, so I think it's always helpful to try to find some sort of commonality. So maybe if they're also USC pharmacy grad, if you guys went to the same undergrad, did similar sort of research, or were involved in some of the same activities, I think that's always helpful. As well as if you see they have a publication or they've done a certain work that you're interested in, you can also just reach out to them and ask if you can discuss it further, ask some questions, and just genuinely show your interest and see if there's things that you both have in common that align with each other. I think that's definitely helpful. And then also, once you identify what career path and what functional area you're interested in, kind of like narrowing down to people that are already working within that functional area so that they can put a name or a face to name. So when jobs do come around or fellowship interviews and that sort of thing, there's people that already know you and are familiar with you.
I guess what are some of your like short and long-term goals? Personal, professional, take it whichever way.
Yeah, so some of my short-term goals, of course, are to finish my fellowship strong, and then land a role as an MSL, specifically within the Southwest region, since I do reside in California. And then for my long-term goals, I'm hoping to continue to advance my career and hopefully grow vertically within the pharmaceutical industry. And then also just giving back to other students, since I did have mentors and people that helped me get to where I am. I want to be able to provide that support for students who are early on in their career and just mentor them, be part of networking events, and see how I can provide that support.
Most definitely. And this is part of mentorship right here. Very much appreciated you coming out and doing this video for like future pharmacy students, even that probably don't really know too much about industry. And
Right.
like somebody like a USC graduate that just graduated doing a fellowship, I think can have a big impact. So thank you again. So I
Yeah,
guess
of course.
the last question, just any like broad advice that you have for current pharmacy students.
Yeah, so I would say going back, if I could redo pharmacy school all over again, I would probably try to network early on. So, or I guess backtracking a little bit, trying to identify what I want to do earlier on. So, I mean, taking advantage of different opportunities, talking to as many people as you can, so you can get an understanding of what roles pharmacists are able to play in different settings. So even considering the pharmaceutical industry, I mean, I didn't know about that going into pharmacy school. So I think looking into the different functional areas from the beginning would have been helpful. So I would have been able to identify that career path earlier on, and then just reaching out to different people, like I mentioned, through LinkedIn, or even people that you know who might know someone that's working in the industry, and trying to build that network earlier on in your career. And also just figuring out what you don't like, I think, is just as important as figuring out what you do like, because that can provide so much clarity. And then one more point of advice, I mean, I don't even know if this is considered advice, but I would highly encourage pursuing a fellowship program, because it does provide a breadth of experiences, and you're able to learn so much about not only the functional area you're pursuing a fellowship in, but also the different teams that are involved in that organization, because each company kind of structures their teams a little differently. So learning as much as you can about the different teams within that company, versus if you were to pursue kind of like an entry-level role, you're basically siloed into that role and you don't have as much of an opportunity to be able to explore and take on these different learning opportunities.
Yeah, most definitely. Thank you. Thank you. I think that was a really strong endpoint. Again, thank you for meeting up with me in IPHO. For future students to have this type of information coming into pharmacy school and moving through, it'll help provide some clarity. So yeah, thank you, Dr. Ava Bamdad, for joining us. Thank you for all of your wisdom.
Yeah, of course. Thanks for having me, Philman, and looking forward to helping students along the way.